So Matt, we chatted about this before. Why do you think it's not worth the risk to develop iPad and Android medical apps?
Because the interests of these companies are aligned to the consumer market. This is only one part of multiple parts. So you can't subordinate critical healthcare products to consumer needs. The manufacturer of iPads and Android products are typically not within FDA compliance. They typically are very highly hackable. They're also not, what's the word? Well, they're not highly legitimate. A patient doesn't hold an iPad and doesn't think I'm holding something that's a medical product. They can be disease transference devices, even if you put them in baggies. They can be, if they become a critical part of the medical environment, they can fail on a regular basis. They're not high robustness as a medical device has to be. So, the list goes on and on.
Okay.
And I'd like to point out one thing. Show me where Apple has succeeded in any market other than in consumer market, ever. Short stints in the education market, short stints in some corporate market, and then they failed at every single one because they're excellent at consumer market. They're the best at the consumer market. So they will do what the consumers need, not what the patient needs.
What do you think about hardware changes and operating system changes? If you're an app developer, medical app developer, how do you keep abreast of those changes, and do you think that's one of the risks as well?
It's the biggest risk. So if there's a change to the encrypted hard drive, if the access isn't changed, if there's cyber attacks, if there are, look at the Windows platform, how many times they've had massive attacks and people have gotten credit card information and people have gotten personal information. Entire companies have been shut down. Economic impacts, and you have massive companies in the United States dealing with one email virus shutting down the entire company. Okay, so the company loses some money. This happens in the medical world, people lose their lives. And that's a very different scenario, and I don't think anybody has tolerance for those types of outcomes. And these devices aren't designed to work with those types of environments. And I think they're happy working on the periphery. I think and I can't answer and I can't speak for these companies, I think Apple's fine sitting on the periphery. They're fine for doctors using it for their personal use or sitting in the DMZ. They're not going to be able to, or even desire, I don't think, to support it in actual medical environments. It's a smaller market fraction for them. It's a very challenging and very regulated market section for them. They just don't need it. It's not their bread and butter.
So what do you tell people that are really looking to build a mobile app and putting it on the App Store or putting it in the Android market? What word of caution will you
First off, check the ethics. It's easy for people to think I have a great way to make money, but this isn't about making money. This is about making an outcome for people's lives. This is first an ethical question. The second one is you have to look at what is the commitment of your hardware manufacturer. Is the commitment also the same as yours? And if it's not, just find another resource. We'll let people put apps on our product, for example. I'm sure that there's going to be more of them sprouting up. But real medical devices or real medical applications